Hi, this is Johannes Huitink. I'm an anaesthesiologist based in the Netherlands, founder of the Airway Management Academy. Today I would like to show you a trick with dual cameras. So it's a dual camera technique called VAFI, Video Laryngoscopy Assisted Flexible Intubation. And we will start in the intensive care unit. I'm on call as an anesthesiologist. They call me to the ICU and the patient needs an urgent intubation. So my assistant will give me a laryngoscope, and then I will put in the video laryngoscope. And obtaining a view in most patients is not that difficult because the companies have made such beautiful equipment that the cameras can look around the curve. But if I try to intubate now, can you give me the tube with a style in the tube? There may be a problem that I cannot intubate the glottis because the tube will not go anteriorly. So you can see it on the image. I've got a good view, but the tube will not go in. I cannot make the curve. And here we have the VAFI technique. What we need here is an assistant and we need a flexible scope. We will look at the video laryngoscopy screen to introduce the flex scope into the trachea. Could you hold the video laryngoscope for me, please? Sure. So it's very important to instruct the assistant to hold the scope like this. Exactly what I do. Can you hold it like this, please? Yes? Okay. Then I will use the flexible scope. I will introduce it into the larynx. And now let's look at the screen of the video laryngoscope. Here it is. I will go underneath the glottis. And now you can see on the other screen vocal cords. And I will easily intubate the trachea with the flexible scope. So I'm in the trachea now, you can see the tracheal rings. And then the only thing we have to do is advance the tube and the patient is intubated. So this is VAFI, and this is a perfect rescue technique, a dual camera technique for patients in the ICU who were accidentally detubated. This is a very good technique for patients who come into ER with bleeding airways. If you use two cameras, one of the cameras will probably have a view. And this is also a very good technique to learn how to use a flexible scope. So the VAFI technique is used a lot of the time. So you need a flexible scope and a video laryngoscope and a very good assistant. Thank you very much.